All right, welcome to another episode of Student Affairs Shares from the Office of Family Engagement. Super excited for our next guest today. And so I'm going to allow them to introduce themselves.
Hello, I'm Dr. Pavika Saripalli, one of the primary care doctors at Watkins Health Services.
So great to have you today, Dr. Polly. Um, I first things first, could you tell us a little bit about Watkins Health Services, what you have to offer our Jayhawks, what are the resources, and anything else that you would like to share with us today?
Certainly. Watkins is a great clinic. We try to cover a lot of aspects of the common needs a student might have. So we have kind of an area which is more of an urgent care for cough, cold, sore throat, sprains and strains, urgent care oriented things. But then we have another area which is for really primary care, a lot of what you would go to your pediatrician or family physician for. We have women's health, men's health, immunizations, lab and x-ray, and we have mental health, a small mental health area as well, and a pharmacy. Can't forget our pharmacy.
Thank you, Dr. Sarah Polly. Okay, and so thank you so much for providing that information. And so we're going to transition into some of our Q&A questions that I'm sure that the parents and supporters of our students will love to hear your responses. So first and foremost, how does Watkins Health Services help students learn to manage their own health care for the first time?
It's a great question. The only way to learn is to actually do it. And so when they walk in the door, they are walking in without their parents for probably the first time. And we're asking them, why are you here today? And do you have insurance? And do you have a preference of whether you see a male or a female or a doctor or a nurse practitioner? And those are things that were probably always addressed to a parent or guardian. And a lot of times, the first thing they'll do is say, "Can I call my mom or dad, or can I call my parents?" Which is totally fine. But the more they do that, the more they realize, "Oh, I can do this," and they begin to get comfortable with that whole process.
Thank you so much. And so, speaking of that process, right? And so, we know that our wonderful parents and families, they definitely play an important and significant role as in their students' lives before they get here to the university. And so, what advice, when they get those phone calls, the parents get those phone calls from their student, what advice do you have for our parents supporting their student through that process of learning how to independently manage their health care?
Okay, step one, don't panic. Never panic. We're here and we understand. A lot of us happen to be parents ourselves. We understand how scary and stressful it is when your young person calls you and you're not with them and you're negotiating that. Um, be as involved as you need to be, and feel free to ask your son or daughter if they can put you on speakerphone, if they're willing to do that, or if you feel like you need to talk to us. We have to get their permission, but don't be shy about that. We're happy to talk. Speakerphone has been great. Sometimes you can just answer everyone's questions at one time, but we have a lot of resources here. We also have a lot of resources in the city of Lawrence and in Lawrence Memorial Hospital. So we probably have access to most of what you have access to at home. And we're happy to work with you collaboratively to help your son or daughter get what they need.
And in that, with you saying that parents are able to be involved as much as they would like, are there any guidelines, protocols,
Yes.
procedures that have any type of restrictions or limitations for our parents and families?
Well, the students are usually age 18 or over, and legally, the law of HIPAA does apply. So we cannot just pick up the phone and tell you any information you want without getting that student's permission. And we have to get the student's permission every time. So a lot of parents have asked, "Can I just sign a paper when we first come in that will cover their entire college experience. And that's not really how it works legally. So we need to either verbally or in writing get permission from the patient before every conversation or every new issue that we discuss with family. Having said that, our experience has been that there are situations where students may really want that privacy, but most of the time they're happy to have a family member be involved. Sometimes they give us permission to directly talk to you. Sometimes they want to be in on that conversation as well, but we do have to let them direct how much information we share.
That is so good to know because I know that, a lot of parents, this is also a hard situation for them to be in as well, particularly when we think about our first year parents and having to untether and let go a little bit. So I'm glad that you
Yes.
shared that.
Yeah.
That's valuable information. And so we know that becoming a Jayhawk is a great experience. We also know that in that experience, there can be moments where students are under high stress. And so, how does Watkins support our Jayhawk community when students might come to you all space and they are, under high stress times like midterms, finals, or maybe even personal things that might be transpiring?
Sure. Stress is huge. It's probably the number one thing we address, after the flu and injuries. We try to make a space in every appointment for mental health. We kind of open that door regardless of why people come in and ask them, do they need to talk about their mental health at all? When we have midterms, finals, the Health Education Resource Office is really good about hosting events, sometimes within the Watkins building, sometimes going out to the dorms or the student unions and promoting stress-free study breaks. The pet therapy partners is always very popular, hosting other events. But we also try to make it just very easy for people to come in, whether it's urgently or scheduled to talk about a crisis moment or to come on a regular basis. And if we can't meet their needs, we can link them with CAPS. We can link them to other psychological services in the community. We're a good starting point, even if we're not going to be able to fully meet the person's need if it's complex. But we try to make every visit an opportunity for a mental health check-in.
And that is so important because, again, we know that college, it has its ebbs and flows. And so to know that that is something that you all offer, I think is very important for our parents and families to know. And so with that said, let's say it's the weekend. What are the aftercare hours, if there are aftercare hours on the weekends in Watkins Health Services?
Well, we're open on Saturdays from 12 to 4. So we try to capture as much as we can in that time. And in the evenings, Sundays, whenever we're not open, the phone number still connects to a 24-hour nursing hotline. So we will get information back from those nurses the next business day telling us who called, what their concern was, and what they were advised to do. And then we'll call that student back to make sure that they either took care of their problem or get them seen if they're still having the issue. But after hours, the nurse hotline will help the student figure out, like, can this wait until Watkins is next open? Do I need to go to an urgent care or to the emergency room right now because it really cannot wait? So the nurses help students work through that process.
And that's really good to know because we know sometimes things come up over the weekend, but it's good to know that the students are still able to get that assistance that they might be needing, depending on, whether it's urgent or not, things like that. And so if a student obviously becomes ill, they come to Watkins Health Services. Do you all offer academic accommodations? Because we know sometimes, depending on where the student's illness is, if it's contagious, things like that, they might need
Sure.
to be out of class for some time. So, does Watkins offer any type of accommodations for students in the event that they have that experience?
We provide a note or letter that sort of documents the amount of time off we think they may need. We cannot divulge a lot of personal information in those notes. Again, that's a bit of a violation of HIPAA law, but we do give guidance about the fact that the person has been ill, has been seen, and that we would expect they may need, 1 day, 3 days, whatever we think is typically going to happen, either off of class or working remotely. The other common scenario is with injuries. If someone's on crutches, somebody may have a broken bone and they need to see an orthopedist before they can really be mobile again. We also try to help with things like the J lift if they live on campus and they need transportation, or other physical accommodations, like they might be on a scooter or something, they might be late to their classes. So we try to put enough information in there that professors have something to work with. If it's more long lasting or complex, we have to work with the accommodations office, the Student Access Center, because they may need an advocate for a longer lasting period of time. And that's the framework the school has to do that.
That is awesome. I know I had to be on crutches when I was in undergrad, so it's good to know that there's, that J lift that can help students get around our huge and wonderful campus. And so when we're at that time of the year where there are all types of, yucky things out there in the atmosphere.
Yes. Yes.
So how does Watkins handle maybe communicating some of those urgent messages that you all might need to get out to our campus community?
Are you speaking of sort of community health when there's something that might affect a good portion of the
Yes,
campus?
yes.
Yeah. So we're a liaison to the Lawrence Douglas County Public Health Department, and they keep us informed of what's circulating in the community, and they keep statistics on what we think we're going to be seeing. So we keep the campus aware, student affairs specifically, and they disseminate it to instructors if we're having a flu outbreak or a COVID outbreak or maybe a norovirus outbreak where it's more of a stomach sort of a thing, just sort of make people aware that we're having very high numbers of this particular infection, and don't be surprised or alarmed if you have a lot of student absence. Be prepared to help people work remotely, make up work. Um, it's rare that we're going to go back to COVID days and say everybody has to mask or something that dramatic. But if the numbers are unusually high, we sort of let the campus know, because sometimes they're a little bit more flexible or they plan their makeup work a little differently if they know a lot of people are going to end up missing class. And of course, we put kind of disease prevention tips on our website and social media.
Which leads me to my next question. That was a great segue. Are there educational programs, resources that students can use to stay healthy throughout the academic year?
We have a lot on our website, a lot of videos and references of different topics that people can work through. We also have the Health Education Resource Office. Their whole job is education, so that's very helpful. And they promote sort of a topic of the week type of thing. And we also put some information on social media and the screens that are around campus at the unions and gathering places. But our website is a good starting point.
Okay. And my last question for you before we wrap up. Obviously, this is phenomenal information, valuable information that you have offered us today. But in your opinion, how would you recommend to our parents and families to stay engaged with Watkins Health Services if they want to know more information outside of what
Sure.
we've discussed today?
I think if they just want to know what services we offer, clicking on the different links on the website is a great starting point. I do encourage families that have specific health needs, especially if they have a student with a long-term or chronic illness, to reach out more directly to either our administrators or medical director. for a more personal consultation. A lot of times that first year or even pre-orientation, we will have families contact us because their student has complex medications or other procedures they have done on a regular basis, and we can better accommodate so that that student is set up before they even arrive. So don't hesitate to reach out more personally if you're not finding what you need on the social media and the website.
Thank you so much, Dr. Saripalli. Can you provide the website to our parents and families?
Sure. I think, I don't know if there's a way to put it in writing, but it's www.studenthealth.ku.edu. And there is a portal as part of our website. I probably should say something about that because it's very helpful. It's just like a my chart that you probably have with your own doctor, but it helps your student very much if you put in or together put in with your student the insurance information every year and then make sure that the medical information hasn't changed. It's a time saver for them when they come in an urgent acute illness if that information's already there. And there's also some email links once you get to that website.
All right. Well, thank you so much for this valuable information. It is so important. We always want all of our Jayhawks to stay healthy. And
Yes.
thank you so much for joining us today. I hope you have a great day.
Thank you. You as well.